hear me? You hear me?
Hello, yes.
Hello, Peter.
Hi, Steve. How are you?
Well, it's good to see you.
Yes. No, it feels like it's been years, but not so long ago. No.
That's right. Not so long ago.
Yeah. Am I on screen or should I change something?
Well, I think you're perfect.
You're good to go, Dr. Lee.
Oh, okay, great. So I'm Bentley. I'm the chair of Department of Psychiatry at the University of Rochester. It's great to see everybody on the line. Normally, under the normal circumstances, we wanted to do this actually at the APA reception, which was supposed to be held this year in Los Angeles, I think. But obviously, Philadelphia. I forgot where it has been. But obviously, because of coronavirus, that we couldn't quite hold it. So instead, what we decided is that maybe do some kind of virtual reception. So this is the virtual reception that we are holding for primarily those who have been alumni of our residency programs and past faculty members, and we're loosely sort of organizing as those who are from University of Rochester Department of Psychiatry. So welcome. And my job for the next 10 minutes is basically to update you in terms of where we are in terms of Department of Psychiatry. So let me just quickly go through that. I'm gonna share my slides. Here's my slide. And you can see I've done this now a few times before. So, what you're seeing is a picture of our Department of Psychiatry, the R building, on a bright spring day. There's a lot of changes that have occurred in the past decade or so, but particularly during the last 3 years. Primarily, the department structure, we've gotten so large that we had to divide our department into 5 divisions. And some of the leaders are on the call as well. Under me, there is a Vice Chair of Faculty Affairs, Yeates Conwell, who is on the call as well. And we also have 3 associate chairs who represent each of the missions, research, education, and clinical service. And we have recently added Telba Oliveras as Assistant Chair of Diversity and Inclusion to reflect our commitment to improve diversity and inclusion of the department. And then we have 5 divisions in our department: Child and Adolescent Division, Collaborative Care and Consultative Psychiatry Division, or Collaborative Care and Wellness Division, and then Acute and Adult Psychiatry Division that relates to inpatients and some of our ambulatory care, and our CPAP, the Emergency Room Psychiatry. And we have one of the largest division in our department is a Community Division that relates to our strong recovery, strong ties, medicine and psychiatry service that's located in Brighton Health Campus. I'll show the picture of you as well. And then Geriatric Mental Health and Memory Care Division is the latest division that relates to geriatric care. Each of the divisions have clinical chiefs and academic chiefs, and their names are listed here. And some of them have joined. And I think the break room is actually divided into the divisional assignment. So think of yourself belonging to one of the divisions. For those who have been, for example, in child psychiatrists, could potentially sort of go into the chat room related to the child psychiatry, and those who have been geriatric psychiatry could go into the geriatric side. We are very multidisciplinary department. So not only do we have the divisions, we also have a disciplines, and we also have a discipline chiefs as well. So nurses, social workers, physicians, psychologists, nurse practitioner. In this time and age, we have more nurse practitioners than psychiatrists in our department. And the substance abuse counselors, licensed mental health counselors, and family therapists, each of those disciplines also have a chief for those. So we have matrix, the organization. We remain the one of the most important, if not the most important mission of our department is education. And a psychiatry residency is now 8 residents per year. And we have pre and postdoc psychology fellows, about 16 psychology fellows per year, as well as we have a very large family therapy master's degree program. We have 28 students at the moment, and lots of research and clinical fellowship, as well as we have a strong partnership with a School of Medicine and School of Nursing and social work and etc. So we are the largest pipeline of the mental health service providers outside of New York City, the state of New York. Our clinical service is really large. In fact, if you look at our budget, close to 90% of our entire revenue. Our entire revenue is about 110 million a year. Of that, about 85 to 90% is clinical revenue. And we now have 140 full-time and part-time faculty members. We've been expanding very rapidly. Over the past 3 years, we recruited about 45 faculty members. And we have 93 inpatient beds. Of them, 20 beds are acute medicine beds. So for those who have graduated from our residency program or moved from our residency program, before we created our inpatient acute medicine unit, we are very unique because we are one of the very few academic psychiatry departments that operates its own acute medicine beds for psychiatric patients with acute medical issues. We have a very busy psychiatry emergency programs that sees over 12,000 patients annually. And we have one of the largest telepsychiatry programs in the country. We cover more than 60 nursing homes, 4 hospitals regionally, and we are in negotiation for much larger coverage with Office of Mental Health for State of New York. And so we are quickly expanding in all aspects of our care. As you know, University of Rochester is also very unique. Unlike many medical schools and medical centers, dementia care is a part of Department of Psychiatry. All of the clinical research related to Alzheimer's disease also belongs in Department of Psychiatry. Finger Lake Center of Excellence is also resides in psychiatry as well. And as I mentioned, we are very unique in that sense that our department has own primary care medical services, as well as acute medicine unit. We have a 20 beds acute unit right above the strong behavioral health ambulatory care program, right below our inpatient psychiatry units. In other words, we have done what's called reverse integration or co-location of inpatient medical care for our patient, and that's probably the only one in the country. And also, we also manage the entire employee-based wellness and behavioral health program for 65,000 University of Rochester employees as well. So all aspects of behavioral health and the wellness program belongs to Department of Psychiatry. So in many ways, we have very broad, multidisciplinary, rapidly expanding programs. And while we are doing that, of course, our academic mission is also very important. We remain one of the only CDC-funded suicide prevention center, where the funding is ending soon. And we are the only VA Center of Excellence related suicide prevention. And our Center for the Study of Prevention of Suicide is nationally renowned. We recently had our T32 training grant that was renewed. So this is going to be strong for the next 5-10 years and so on. We are also one of the 3 regional center of excellence in relation to substance abuse education in the United States. We received a $9.5 million HRSA grant to really stem the tide of opioid epidemic last year for the Appalachian states. We have a very close relationship with the Monty Neuroscience Institute. We are very strong on schizophrenia neuroscience, particularly with the arrival of Steve Silverstein as the Associate Chair of Education. He's the now holder of the George Engel Endowed Professorship. We also do a lot of research with the chronic pain research based on multi-modality, neuroimaging modality, fMRI, DTI, EEGs, and etc. We continue to do a lot of outreach, advocacy-based research. We are the model, birthplace of forensic acting that Steve Lamberti has developed. And which program relates to transition from forensic facility to the communities led by Diane Morse. And our LIV, Laboratory for Interpersonal Violence Victimization, is led by Kate Cerulli. And we are also a renowned place for the developmental psychology and child psychiatry. Tom O'Connor, who has the Lyman Wynn Endowed Professorship, leads the Rochester ECHO project that looks at the prenatal stress as the marker for neurodevelopment of the infants and children. Is one of the very well-known studies in the country. And Peter Wyman, the academic chief of the child division, runs many studies related to sources of strengths model. He recently also received a very large NIH grant related to vaping prevention study. We are doing well. In fact, we even did even better during the COVID-19. Compared to last year, our overall research budget revenue also increased by 7 million, despite the, and at the same time, our clinical service has been doing also wonderfully as well. Despite all the barriers and all the difficulty that is imposed by the clinical, by the COVID-19 virus, our clinical service never really stopped. The lowest amount of clinical volume was about 4% below the last year's volume. In other words, that we just kept seeing our patients. We converted a lot of clinical service into telepsychiatry. Now, right now, about 50% of our clinical services through telepsychiatry. And you can see we were down a teeny bit, about 2 to 4% during the COVID months, during March, April, May. But by June, we are up 10% compared to last year. By September, we are about 12%. By October, we are about 15% above last year. In other words, that despite coronavirus, we are continuing to grow. As you can see that we are geographically divided. Division of Acute and Adult Psychiatry and Division of Collaborative Care and Consultation Liaison Psychiatry is in the R building that you see here. And we right now that we are also in the process of construction as we are expanding our acute medicine unit by another 10 beds. And that's going to be completed by July of next year. So that's another exciting thing that's happening. We recently opened a new downtown center, the Strong Behavioral Health Clinic, that moved to the from the R building to downtown campus. This is for the University of Rochester Medical Center, the largest outpatient footprint for our center. we can, we also opened our $12 million Golisano Pediatric Behavioral Health and Wellness Center that just opened in the middle of COVID virus epidemic last June. And that's something that Michael can and talk about at some point. And our division of geriatric mental health and memory care is based in the 315 Science Parkway building. We are busy right now renovating that building to house memory care program, older adults program, geriatric telepsychiatry program, as well as AD care, the research program as well. The largest program, as I mentioned, is the community psychiatry division that's located in Brighton Health Campus. We have nearly 100,000 square feet that houses severe mental illness program, addictions program, a primary care medicine program for the patients with severe mental illness and addictions program is also based there. We late last year, we opened our young adults program, and by renovating another 20,000 square feet. And so, as I mentioned, our psychiatry program is continuing to grow despite COVID-19 epidemic. And our vision of developing a psychiatry without boundary continues. We are talking about developing a truly multidisciplinary department that maximize not only physicians' expertise, but nurse practitioners, psychologists, the family therapists, social workers, and all aspects. So no boundary between disciplines. We also want to build a department of integrated missions across clinical care, community service, research, and education. And finally, we're developing a biopsychosocial department that aims to integrate behavioral health service everywhere. We are now collaborating with every surgical and medical departments at the University of Rochester, just as George Anger and John Romano has envisioned. And on that note, I'll finish. And then I'll pass it back to Brenda.
We're actually going to go right to Dr. Scharf to give us an education update.
All right. Well, it's a pleasure to be here tonight and see some of you for the first time, and many that I know but I haven't seen in a while, including Peter. I want to give a shout out to Peter, and I don't see his face, but Amr Burhan is on, who's one of my classmates in residency. So it's great to see some of you here, and some I'd be meeting for the first time. Speaking of time, I'm going to do our best to keep us on time, and I'm going to forego slides, but I can share them with people if they're interested by email. But essentially, the biggest changes have been, if we go way back, which would be before my time, the size of the residency decreased in 1992, and we've always had other disciplines, psychology training programs. We've had a master's in family and marriage therapy that's been an outstanding program and a model training program for that field, the only one in a medical center. As the residency kind of got used to the new size, if you will, and things evolved over time, increasing numbers of residents went into child psychiatry. We've seen a real growth of the child psychiatry training program, to the point that we could predictably count on people fast tracking and use the fourth year numbers to make a small expansion in the residency. So without any increase in funding, we went from 4 a year to 5 a year, knowing that over time, averaging out, about half would go into child. And then in 2015, we made another big increase to 8 residents per year, which is as large as the program was in the past, but for us, that was a big change. It was essentially doubling the size of the program with all of the new rules and new clinical services and requirements, much of which you've already heard Ben talk about. We've formalized a child track now, so there are 2 of our 8 interns, when they match out of medical school, match directly into both general and child psychiatry. And we have our other fellowship programs, including the forensic program, which we, like child, we had forensic training before it was an ACGME fellowship, and it was one of the first accredited. The Steinberg Fellowship of Psychiatry and the Law continues with Rob Weisman as the director, who's on the call now. And Rich Ciccone continues as co-director of that program. We have a geriatric fellowship. EJ Santos is on the call now. She's the division chief for geriatrics and the fellowship director. We also have a consultation liaison psychiatry fellowship. And we are working on developing an addiction psychiatry fellowship. Target date to start taking trainees in that program is realistically 2022 for the first trainees. So there's a lot of things happening, expanding the size of our training programs, expanding the number of graduates, and ultimately that's the largest part of our workforce, both in terms of doing the clinical work and all of the innovative services and expanded services that you heard Ben talk about, and also for our academic missions and endeavors, both continuing our education efforts and some of our research efforts. And I'm going to use that as a segue for you to hear directly from one of our residents, who it was chosen to speak tonight by no coincidence. In many ways, he's a role model for a Renaissance man of psychiatry residency, not only excelling clinically, but has done a number of really interesting, largely self-motivated projects. And I look forward to hear what he has to say tonight. That would be Josh Wortzel. Josh?
Thank you so much, Dr. Scharf. So hi, everyone. It's a pleasure to get to see many of my professors here, and some faces I also don't know. But I was asked to talk tonight briefly about why I chose to come to the University of Rochester and some of what I've been doing as a resident. And I think just as Dr. Lee and Dr. Scharf have said, I was drawn by just the wealth of general psychiatry training that I would be able to get here from so many of the wonderful faculty members who are here. I also really enjoyed getting to work more specifically with key faculty members in independent study. And actually, I'm looking at Dr. Munson right now. I've had a true pleasure getting to work with him, and just was so impressed when I visited about how committed faculty were to teaching, and that's really borne out. Dr. Munson and others like Dr. Oldham take time out of their day just to meet with me very regularly to go over papers, and that's really something I truly enjoy. But another thing that really drew me to the University of Rochester was its ability to kind of craft the kind of residency that would allow me to do research and other academic pursuits. The university provides funding almost entirely for a master's degree, so I've been able to do a master's in health professions education at the Warner School. With kind of this evolving idea that I'd like to be someone trying to innovate in medical education. And I have worked with people at the ed school as well as in our department to work on a few projects. So we receive funding through the ACGME accreditation for residency programs to, we got this national grant to look at training residents in doing group therapy. And so it's a 2-year grant. The first year, we created a series of didactics that the residents underwent to then conduct group therapy for patients on our inpatient unit in 292. And then the second year of the grant, which we're unfolding right now, is residents in the psychiatry department leading process groups for residents across the hospital, so for all disciplines. And we're looking empirically at how that's impacting resident burnout and wellness. So that's one project. I got to work on a really neat education project with Dr. Oldham and Andy Francis, who's one of the original authors on the Bush-Francis catatonia rating scale, to create training videos for how to assess for catatonia. And so we've disseminated that across the country and are gathering data from people basically taking a pre-course assessment and post-course assessment to see how our education impacts their knowledge base. So we'll be hopefully writing that up soon. And then I've also had the privilege to work with other faculty members, specifically Dr. Wyman. I've got to work with him on some of his vaping prevention programs in elementary schools or middle schools for educating kids. But on top of that, the department's just been so supportive of anything that I've wanted to do. They had nominated me for one of the APA fellowships, and I received the APA Leadership Fellowship. And I'm pursuing things in the APA now on trying to reform psychiatry education. And also I'm on the APA Council of Addiction, working on developing educational materials to try to teach kids about substance prevention. And I was recently also appointed to the Academic Psychiatry Journal, which is Advert's journal, as their trainee editor. So I'm very much looking forward to getting to work with them. So I'm so grateful to the University of Rochester and what it's offered me.
Thank you, Josh. I'm going to add just a couple comments to kind of wrap that up. You might be thinking, how do we do that? How does Josh get to do all those things? Some of it is because he doesn't sleep, but it's also because we've been able to maintain something that was really established back in 1992, which is we don't run the services on the backs of residents or on our trainees at all. We are truly able to have flexibility of how much service year to year. Now, once we make the schedules, of course, as Josh will tell you, you really have to do the work you're scheduled to do. But our inpatient services are much larger than we'll ever have residents to staff. Our outpatient services are much larger than we'll ever have residents to staff. And so that really does allow us to create, meeting the floor, if you will, of what the ACGME requires, individualized education opportunities. And even as we grow, both clinically as an institution and as a training program or training programs, we still maintain a sense of relationship and mentoring. I think Josh really expressed that well. And I also want to recognize Steve Munson. People who are in the child psychiatry world may realize this or may not, but since we've had an accredited ACGME fellowship in child psychiatry, there's only been 4 training directors, and you are in the presence of half of them right now. Steve was a training director for more than 20 years, and I was the training director of that fellowship for 15 years. And it's now led by Dr. Kathleen Baines. So I think I'm going to turn this back over to Brenda to transition us to the next portion.
Yes, thank you. Thank you all for those great updates on the department. I wanted to formally introduce myself. I'm Brenda Geglia. I work in advancement with the Department of Psychiatry, along with Brooke Hool, who is also on the call, and Zena Schubert, who handles community outreach and engagement for the department. And we had planned to host a formal celebration of the 75th anniversary of the department this fall that has, as you can imagine, been postponed. But what we're looking to do in the next year or so is to connect with as many alums of the program as possible. We want to hear from you. We want to hear what you're doing in your careers, what you're doing in retirement, what was meaningful to you during your time here. We want to locate some of the classmates that we've lost and connect you with what's going on at the university, connect you with students and faculty. So you'll be hearing from us. And I also invite you to visit the alumni section of the website, sign up for the newsletter, and just really happy to have everyone here tonight. And I think we'll be heading into some breakout rooms where you'll have some time for conversation. And again, thank you for coming out tonight.